afternoon. And welcome to, well, I was about to say August, but it's September medical lending. And before we get started, I just want to highlight in the back of the room is our newest part of our department. It's called Community Health. Wade?
Hello, you already know us.
And that they will be coming to Medical Monday every month in the future. And today, if you can sign up and have your blood pressure taken and also register to win a prize. As we are going through the day, if you can quietly go over during the presentations, you can get your blood pressure taken, as also be registered for the prize. So then they will, and the drawing will be at the end of the day. So today we have Matt Wright, our ever shrinking Matt Wright. Okay, what are we now at, Matt?
161 pounds lost. So.
I think you probably can chase the twins now.
Oh yeah.
Matt has twins. Are they 5 or 6?
5 years old.
Okay.
Yeah. So.
As well as we have Shea Zigler from the Family Resource Center, who will be speaking for our community benefit spotlight. So they're real excited. And now I'm going to turn it over to Matt.
All right. Good morning or afternoon, everybody.
Good afternoon.
Do I need this? I'm pretty loud without it.
You need it.
I need it. Okay. Okay. So I'm Matthew Wright, medical or not medical. I'm just an exercise specialist, but also a certified fall prevention specialist for Reid Health in the Reid Fitness Department. I have been working fall prevention now for about 5 years, and we're helping out many people in the community that feel unsteady on their feet, trying to give them the best life possible. So falls are a public health concern. So a fall is an unintentional event in which results in a person coming to the rest on the ground or another lower level. Doesn't that sound really nice? You know, they make that sound great. So we all know what a fall is, okay? Planned trip to the ground. According to the CDC, roughly 36 million fall cases are reported each year among older adults. That results in more than 32,000 deaths every year associated with falls. 1 out of 5 falls result in an injury of some sort, and more than 95% of those are hip fractures, falling directly on your hip. And women fall more often than men. That's the one thing men have on women. Okay? That's it. That's all we have. Okay? Some of the risk factors with falling are limitations to mobility, impaired walking patterns, visual disturbances, just being weak, use of multiple medications, poor balance, and hazards in the home. And I'm going to go through each one of these. So limited mobility is any physical limitation that causes pain or prevents ease of movement. So you're thinking your arthritis or injuries that you may have, like how many of us probably need a knee replacement that we're putting off, you know, type of thing. Muscular dystrophy also falls under this. Impaired walking patterns or any abnormalities to your normal walking gait or walking pattern. This is shuffling. How many here shuffle when you walk? Okay, it's all right. Okay, it's easy to fix. You just got to think about it. Limping or taking short steps, short choppy steps. Okay. And another one, as you get older, drop foot, dragging a foot as you go through. Kind of see that. Those are common impaired walking patterns. Visual impairments, the partial or total inability of visual perception is what that means. So having cataracts, poor blurred vision, color blindness, okay? So if you're colorblind and do not see the yellow on the curb to know that that's a curb, okay? Or how many in here have bifocals or trifocals? Okay, being able to look through both lenses as you're trying to step up over a curb. It's pretty difficult, right? Okay. Poor reaction times. Reaction time refers to the amount of time it takes for an individual to perceive and then respond to a stimulus. So factors that can affect reaction time include age, physical condition, and mental health. So a lot of falls happen because you go on, lose your balance, and you don't react to take that reaction step to keep yourself upright. So how many people you just see kind of take a stumble and they just go down, okay? So as you get older, you lose that if you're not working on that. And so that's another risk factor. Use of multiple medications. How many people are on a lot of medications? Okay, quite a bit. Okay, medications don't always play nice with each other. Okay, or how many medications, if you read the fine print, say may cause dizziness. Okay, so if you're taking a lot of medications, they, interact with each other, may cause a lot of dizziness or vertigo, impaired balance. So this is something to be constantly in contact with your doctor or a pharmacist. Okay, if you're starting a new medication, like taking something over the counter, make sure it's okay with your doctor so it doesn't mess up anything you're already taking. Common categories of medications associated with fall risk include sedatives, antidepressants, and diuretics. Okay? Hazards in the home. It is important to stay vigilant for any possible fall hazards at home. This includes keeping your walkways clear, making sure your rugs are secured down, not like loose on hardwood and you take a step and it's like skates, okay? Or the biggest hazard at the home, which I'm not saying get rid of them, but like little dogs, little cats, okay? They like to go right in between your feet. I have 2 beagles at home that like to try to take me down, okay? That kind of stuff, you want to make sure that you're taking care of the hazards at home as well, okay? Lighting is another big hazard. Didn't know until I started renovating my old house, there's a lot of different color temperatures of lights. The brighter, the cool whites is better for your eyesight as you're seeing going up and down steps. So some stuff like that to look for as well. So I have a piece of paper, if Nathan can hand this out for me. You don't have to do this now. But this is just through the CDC, through their STEADY program, they have a checklist that you can do for yourself and answer it honestly with yourself away from here. You can do it now while you're eating, that's fine. But it tells you like, yes or no, circle one. I have fallen in the past year. If you circle yes, it tells you why it matters, okay? So it goes all the way down to I often feel sad or depressed, okay? So this is something that you can do on your own and through the CDC that show you if you are at risk of falls. So if you take that little questionnaire and you find out that you are at risk, probably asking what can you do? First and foremost, talk with your physician, okay? Discuss that you're starting to lose your balance, or if you've fallen recently, it could be as simple as, like I said, the medication. They may need to change a different medication for you, or they may refer you to physical therapy, okay, if you're having some vertigo issues, or they may suggest going to a fall prevention program, a fitness class, which we'll go into more later. So like I said, review your medications with your physician. Stay active. So finding activity that is safe for you to do, and then make sure the home is safe by removing any of the potential hazards, like making sure there's grab bars in the bathroom or going up the steps, making sure your rugs are all secured down. So the staying active part. So this is where I come in. This is my expertise as a fall prevention specialist. I am part of the Reid Fitness program, and so we teach a lot of exercises for different populations. We have Parkinson's disease, those with cancer, those that are fall risk, diabetes, you name it, we work with that. And so this is my bread and butter. This is what I'll be spending most of the time talking about. So example of exercises that typically are most common associated with fall prevention is Tai Chi, yoga, either standing or seated, silver sneakers, like those types of group classes, silver sneakers steady is one that they have. And then fall prevention specific exercising program, whether that be through the hospital, like something I teach, or something that a local gym teaches as well, okay? or you can find activities. A lot of resources are available through YouTube. If you go to YouTube, type in fall prevention exercises, you can find small little 15-minute clips of watching exercises that you can do at home. Or some places like the University of Carolina has something you can request them to send you a booklet home for exercises to do at home. But my suggestion with doing the YouTube and all that, make sure you find someone to help you keep yourself accountable. Okay, because it's often easy to have this book and say, yes, I have the book. That's the first step, but then that book collects dust because you never use it. Okay, so make sure you find someone to help you keep accountable that you're going to do that if you're going to use that for improving yourself. So how much exercise is recommended for an average person? All right, so through the American Heart Association, it is recommended that you have 150 minutes of moderate exercise or 75 minutes of vigorous aerobic exercise each week. Okay, so that breaks down just roughly over 20 minutes of moderate or 10 minutes of vigorous aerobic exercise a day. Okay, moderate activity is anything that increases your breathing, but you're not out of breath while you're doing it. So walking and still holding a conversation with somebody. Okay, whether that be outside while the weather's still nice, or inside around the mall or anything like that. Vigorous activity is you'll begin to sweat just after a few minutes, and you'll be hard to hold a conversation because you're going faster. Okay?
Can you walk in place?
You can walk in place, absolutely. Yeah. My wife actually just bought for our house a walking pad. She got it off a bid site that have local here, and like we'll just turn that on and walk in the basement on. It's like a treadmill, but it only goes walking speed. But yeah, you can walk in place. Absolutely. So another thing you can do physical, and this is, I'm not going to make any of you do this today, I'm just going to explain it, okay, is their sit to stand test, okay? Nancy here, I'm not going to pick on you. She's in our program, okay? She does a lot of sit to stands, and she probably thinks it's crazy. This is the reason why. So the one exercise you need to do that matters everything in your life is getting out of a chair, okay? How many of us have to do the push off the leg and the groan as we get up? Okay, it's all right. I've been there too, okay? So sit to stands, you want to be able to stand and sit in a chair without using your hands to push off at least 12 times if you're age 70 to 74 for a male, or at least 10 times if you're 70 to 74 as a female on your own in 30 seconds. Okay, that's the standard. If you're lower than that, then there's a deficiency. Okay, now I will only pick on myself, but before I started my weight loss journey, I did one and I was winded. Okay, but I know I worked at that, improved it, and you don't realize how much that helps your balance working on that, because you have to have leg strength, core strength, and endurance to get up and down that many times in 30 seconds. Okay, so I'm going to give you a couple other data here. So if you're 75 to 79, still greater than 10. If you're 80 to 84, it's greater than 9. And 85 to 89, it is greater than 8. Okay? And that's just the standard. Okay? All right. So if you're looking to start your fitness journey, I mentioned that Reid Health has a program that is designed to help you reach your goal for fall prevention. All are taught by certified professionals. Myself or my colleague, we are all licensed in fall prevention training to ensure that workouts are safe and effective for you. Programs are available in Richmond. So the fall prevention program we have one-on-one sessions, either 30-minute or 60-minute sessions, or we have small group sessions where we work with up to 6 people per hour. That we work on tailoring the program to what you need. And now see, this is different than physical therapy is that physical therapy, you got to follow a plan of care if you didn't know, so you may do the same exercises over and over again. We take you each as an individual and tailor the workout to what you need. And so as far as if you're an avid gardener, I will get as creative and have you stepping over a water hose as you're carrying a bucket out to something. I'll have you bending down like you're tending to the flowers, then standing up to move. We even have someone that in our program who When they came and saw me, they just got to be able to move a little bit. They were paralyzed from the waist down, and we have her ready to run a 5K for Disney coming up that she's working with me. So whatever your passion is, we tailor that in there into that program, and we make sure it's all safe and effective. And in my program, I will tell you, I have not had one person follow me at once at all. So it's pretty awesome, okay? We focus on gait training, strengthening, flexibility, you name it, we work on it. And we have fun doing it. I always tell my clients, if I don't make you laugh once, I failed, okay? And the workouts are always hard, because if I made it easy, then I failed you as well, okay? So that's just that program. All right, if you are just mad at the world and want to hit something, yes ma'am, sorry.
Where is that?
So that is over I'm going to butcher the name now. I'm going to call it the Reid Orthopedic Center. I think they changed it to the Comprehensive Bone and Joint Center because, you know, that rolls off the tongue. But the old orthopedic building behind Frickers.
Of course.
Yep, so 1400 Highland Road. So that is where we're located in the athletic training clinic. So you go in, immediately take a left. We're in that suite there. So like I said, if fall prevention is not your jam and you just want to hit something, okay, we do have a boxing class. It all started with Rock Steady Boxing for Parkinson's disease, which is an amazing program that is we at the hospital have done for 11 years to help fight back against Parkinson's disease. We have tailored that to be open to everybody in our HIT boxing. The name stands for high intensity interval training. Now, do not let that scare you. We modify to what everyone's fitness levels are. Okay, if we come in and ask you to do a burpee, we'll have many different options for a burpee, okay, or running or anything. We modify all of that. Those are offered at the Reid Health North Complex or the old Highland Heights Elementary School. People would probably recognize that more. In the gymnasium. And we have a morning class for 50 plus population that meets Tuesdays and Thursdays, 9 to 10, 10 to 11, 11 to 12. And then we have an open to anybody class where our youngest is 16, our oldest is 86. In the night class, Mondays and Wednesdays, those are 5 to 6. Yes, or 5:30 to 6:30.
Like that, seconds. We don't talk about cost.
That didn't, yep, I'm gonna skip over that. Yep. So those are those two programs that we offer. And then the last one here, I'm gonna put Nathan to work again. You didn't know that. Is another checklist that you can have for home. This one here is home safety. So this goes through stairs and steps, indoors and outdoors, some things to look for. So like always keeping objects off your stairs, make sure you check that. Making sure that you fix loose or uneven steps. So how many of us have wooden steps that probably need some tending to? Making sure those are done. Having an electrician put an overhead light and light switch at the top and bottom of the stairs. Okay, so those kind of things are on here. It even goes to floors, bedrooms, bathrooms, kitchen. The biggest one is making sure you have a lamp or something, and it may be on here, it may just be from my experience, have a lamp next to your bedroom, because how many have to go up and go potty in the middle of the night? Okay. Most people will leave the lights off, and that's where a lot of falls happen, is you're trying to go to the bathroom in the middle of the night, so a little lamp that you can turn on. Okay? There any questions? Yes.
There's more and more studies coming out about the value of pets.
Yes.
That people that have pets live longer.
Absolutely.
Is there a safe way to do it?
So there's a safe way. Getting a dog well trained, obedience school is going to be your best case, but a lot of that is pricey to get a dog trained. We looked at getting my beagles support animal trained, and it was a big ordeal, because where most of the people have support animals, it's very beneficial as you get older to have an animal at home. They don't necessarily go through the training for that, and so they don't learn to not go underneath the feet, where you can get a trainer that teaches that. And so that's the safest way that I would say. Or setting off boundaries to where that dog does not go in certain or cats. I'm a dog person, so I don't want to leave out the cats. My wife's allergic to cats, so that's why I kind of ignore cats. You want to make sure that they stay out of like the bedrooms, that kind of stuff, anywhere that you're getting out of bed and you can fall on them. But that would be the best thing I would suggest, is getting a dog or cats well trained. I don't know if you can train cats though. Pretty crazy. Okay.
How much of this does insurance cover?
Am I allowed to go in that? How much does it? Insurance coverage and stuff. Okay, so for the programs at the hospital, we're out of pocket for all our services. Tend to be when insurance gets involved, prices tend to go up because there's more process with that. So these are all out of pocket. There are some that are able to get it reimbursed through their insurance, through like a Silver Sneakers or through other fitness programs that some health insurances have. But I also do know that the YMCA has Silver Sneakers that is, the Silver Sneakers program, if you qualify for that, is free of cost. So, or there's YouTube as well, like I mentioned, as another accessible option for this as well. The only difference is, like I said, I would try to have someone that'll help you keep accountable for that and make sure you're doing things right too. So the beneficial of exercising in a group, you have motivation because you're with a group, or you have an instructor, making sure you're doing things safely and effectively. Where at home, you might be watching this person do squats and you're over here like, oh, I'm doing what they're doing, and not doing it the right way, and you can cause yourself pain or injury. So that's the benefit of having instructors or group classes, but if cost is an issue, there are plenty of free options out there. Okay, great question. Any other questions? Yes.
I might have missed it, but do people come that are referred to you, or do they go to physical therapy?
Both. So we have people that that walk in that they feel a little unsteady, and that is honestly the best time to get to work with somebody, when they're starting to feel unsteady, because you can improve and better their life quicker. Versus someone who comes in completely wheelchair bound, if they think I could fix it in a week, I can't, type of thing. It will take some time, but we do have some referred from physical therapy, and we have some referred from cardiologists. I mean, any doctor that notice, like if you've had a fall or you feel unsteady, we're able to help with that. That answer your question?
Yeah, at the same time, if I just want to come.
Absolutely. If you want to come, my information, I will stick around for a little bit and give that out to anybody. My phone number for the program or for the clinic, as I don't know if we have those here. Do we have the flyers with the number? Okay, I forgot to print the flyer here with that. But if you go to Google and just type in fall prevention, Reid Health, and go on there, you give us a call. And if you're interested, we'll gladly get you set up. We do an assessment with anybody that is completely free of cost. That we can sit there and just kind of see where you are, and we can tell you from our eyes, yes, we think that you're a fall risk and you could benefit from this, or no, you're not. This is some stuff you can do at home to stay where you are, to improve. So we do have that available as well. Great questions. Any other questions? Yeah.
I don't have a question, but I want to say on his behalf, he didn't pay me to say it, but
I didn't.
I have gone, he used to be my boxing trainer, one of them, but I've seen him with the fall prevention people, and because I go there for another issue, but he's very patient, extremely patient. They do work at your own, they're at the client's own pace, and it's very beneficial, very beneficial. And you don't do the same thing every time you go. You do different. He's very good about having a plan for the individual and making it so that it'll work with your lifestyle and with your capabilities.
Absolutely. Thank you.
I fell this summer, and my daughter printed this up for me, and I just called and made an appointment, and that gave me a test. And I've only been going 3 weeks.
3 weeks, yeah.
Twice a week, and I can't tell you how much that has helped me in just even a short time. I have to admit, when I leave there, I am so tired.
I will carry you to your car if you need it. Okay. I promise that. Yeah.
Then I come off to my car, my legs are wriggly after. But it really helps.
Yeah.
And if anybody needs it, it's a great program. And for $10 a lesson,
I didn't say that.
it's
Yeah.
I'm a volunteer coach at Rock Steady Boxing on Fridays.
That's why I'm bossing them around, if you can tell.
And see the patients and how Matt and the team works with them, and just to see how when I first started, how their endurance has improved over the months. It's a real pleasure to be part of the team and to watch their progress.
Yeah.
It's a really good class.
Yeah.
My dog walks me about a mile every day.
Yeah. Probably not at the pace you want to go, though, right?
Like a rabbit.
Yeah. Yeah.
Yes, yes. So I have a lot I get both the walking and then the upper body strength from hanging on.
Absolutely.
So is that,
That's great. Fantastic. Okay. I would call that close to vigorous if they're chasing. My suggestion is if you start noticing you're shuffling your feet or anything, and this is something for all the shufflers, this is a tip for free for everybody. You got to make sure you're walking and thinking about your steps, because when we walk, we're just walking from point A to point B. I'm not really paying attention to how I'm getting there, and you see a lot of shuffling. Find something in your mind that'll get you to think about it. The thing I use for my classes, I tell everybody step on spiders, because who likes spiders? Okay? And I always tell them stomp on the spiders, and they start walking and they're stomping on the spider. So if you start noticing you're shuffling when you're walking with the dog, just try to find something that'll help you visualize picking your feet up. And if you're putting your foot down like you're stomping, that dog can't take you very far. See? Okay. What I can tell you is that exercise oftentimes is very daunting or scary for people. Okay. Finding a class and doing something with a group of friends or find a good group of people is going to help you that gateway into exercise. But I will tell you, exercise is very important. Okay, and I'm gonna pick on myself here. So like I said, when they brought it up, I've lost 161 pounds over 2 years. Well, not exactly 2 years yet. I went to the doctor. I was the manager over the programs before all this. I went to the doctor, high blood pressure. They said they're gonna put me on 3 different medications. And I said, no, I wanna do this myself. I can't believe I let myself get this way. And they're like, yeah, when you fail, come see us. And so I took that as internal motivation that I'm going to prove this doctor wrong. And I have done it. I've never been on medication, and my blood pressure is great. But I will tell you, as at that time, 29, I was a baby, okay? I'm still a baby, I get that. But I could not stand on one leg for 5 seconds. And we were sitting in a class, and they told us a very scary thing. And don't read into this, but they said, as functional aging, is another certification I hold, if you can't stand on one leg for at least 5 seconds, it means something catastrophic can happen in your life in the next 2 years because you're not physically fit enough to handle something. And that just hit me as a 29-year-old going, I can't do this. And now I can stand here all day, okay? And I'm just working out, I'm eating healthy, I'm exercising. And so what I do is I tell people is that your mind is the biggest hurdle for anything you do, okay? And a way of showing that is when you stand up, you stand on one leg, and you do that, you're thinking about it, you're shaky, probably not able to do it, okay? I'm not gonna make everybody do it in here because I don't want anyone falling in here. But if you just touch one thing with your finger and you hold it, your brain like, oh, I'm good. I can hold it here, okay? That finger is not gonna hold you up. But that's our brain getting a different sense in that says, I'm safe, I can do this, okay? So we, at these programs, help teach you these things and help make you more confident, improve your overall life, and teach you these different ways to help make your life better away from here. And we have fun while we do it, okay? So I can tell you our team is amazing. I work with some amazing people that will help anybody, no matter where they are in their journey. But I want to tell you, even if it's not working with us, take time to find something you like to do, okay? If you have not exercised and you do feel unsteady, but you're worried about going into a gym atmosphere or anything like that, walk outside with the dog. Make sure they don't pull you too hard, okay? But walk outside with the dog. Just walk outside and enjoy it, the weather, okay? If you're watching TV and you're like, I don't want to miss my shows, watch your TV. Every commercial, do some sit-to-stands out of your chair, okay? Make the commercials an exercise. Okay? So just find something that'll help you, okay? Because I trust you. I feel like a whole new person being able to exercise and do all this. And I'm not like doing heavy lifting or anything. I was a football player. I feel in better shape now than when I was a college football player. Okay, taking my health in a hand, and like now's the time to do that. And if anyone looks at you and says you are too old to exercise, tell them you're only as old as you feel, okay? And they're ageist, and to shut up, okay? All right, because no one is too old to exercise, okay? There is a gentleman as a physician that holds a plank record, holding a plank where you're on your forearms and feet, and he's in his 90s. And I'm thinking it's hours is the amount of time, okay? Okay, I know many people that are in their 80s, 90s running Ironman races, which is swimming, biking, running, okay? You're never too old to exercise. Yes.
Are there any conditions that you cannot work with?
I'm a confident man. I help anybody.
That you can, okay.
Yep. That's honestly, I have not had a condition that I have not helped. I've worked with MS. I've worked with a person with a prosthetic. I've worked with someone who's paralyzed from the waist down. I will tailor their workout to whatever they need it to be. Some may need to be one-on-one because they need a little extra hands-on, but in a group setting or anything, I will tailor the workouts to whatever they need. Yeah, because I'm big into this. I have grandparents that were grown up in this area. I want to make sure I can make the world as better as a place, so I'm a forever student of this. And so if someone comes in with a new challenge of I have this issue, then I will study it and make sure I'm the most prepared person to help that person. And our other instructors are the same way. Yep. Okay. Now, also know that you got to laugh. You got to enjoy life. Like if you're going to come see me, you got to be prepared to laugh. Okay. And you're going to think I'm so full of it, my eyes might be brown. But trust me, I'm telling you, you can do this. Okay. Any other questions? No? Okay. Yes.
Can we just have a quick plug for the Silver Sneakers program? Yeah.
Yeah.
Family Fitness.
Yeah, absolutely.
And I started Medicare with a Advantage plan, thinking that was the only way to do it. But there are Medicare supplements that include the exercise benefits.
Absolutely.
It's not called Silver Sneakers.
Yeah, forget the other couple names.
Renew Active.
Renew Active, and I think there's Silver and Fit too, was another.
But whatever the insurance calls it, you get to go to Family Fitness Works and takes the exact same classes.
Yep. Yep, so be your own advocate and look out because there's a lot of things available. I thought I saw a hand over here.
Sandy's one of the teachers there.
Yeah.
Oh.
We are her students.
There you go. That's good.
Just came from the gym.
That's good. That's very good. So like I said, I've known a lot of instructors at the Y, in Connorsville, everything that do Silver Sneakers as well. They're all great programs. Just find something that you want to, or you feel have fun and it's passionate for you. Okay? Okay? Because, yeah.
My husband's balance is terrible.
Yes.
But he also is suffering with a low back injury from years ago.
Mhm.
So he has there's a lot of things that really bother him. He can't really do a lot. But can you help someone
Yep.
in that situation?
Yep, I actually have a couple clients that we have to slowly work the core stronger to offset the back and then work on it from there. So it's a longer process, but yes, absolutely.
Okay. Because he's getting ready to start physical therapy.
Yeah.
Yeah, he hasn't got that set up yet. They haven't called.
Yeah.
But anyway, but I was wondering if you would
Yep.
with those
Absolutely.
individuals.
Yep. So I can modify any of the workouts for anyone that is wheelchair bound to, I've worked with a couple of Division I athletes. I will take whatever their base route is with the assessment and I'll see if it's low back pain is causing a big majority because of a weakness in the core. I will tailor out a workout and process for them of let's get the core stronger, let's do it. And if it starts to hurt, we'll change on the fly. So a lot of my programs are basically on the fly programs, as in I read the person as I'm working with them. And if this is working and this is what they need, we'll keep going. But if it's just causing pain, we move to something completely different.
But it's not guaranteed that the physical therapy is really going to do any good.
Yeah.
So, that would be, this would be another option.
Yes. Yes, would. You're welcome. Yeah. Thank you.
Thanks, Matt.
Absolutely. I don't want to break this.
I don't have a presentation. Also, just a reminder, next month, we will not meet the second Monday, we will meet the third Monday, which will be October 21st. We had a conflict, and so we need to meet the third Monday in October. And I'll send out a letter with the announcement, but just to make sure everybody's aware that we will meet the third Monday in October and not the second Monday. And next, we have a newer group we want to introduce you to, the Family Resource Center. I know some people have actually been to the Family Resource Center events. It's actually on North 12th Street. Depending if you're going north or south, it's near Mount Olive Baptist Church. And I'm excited that Shea is here to tell you all about the Family Resource Center. So I want to introduce you to Shea Zigler.
Thank you. Right. Yeah, I'll just set it here. Right. All that talk about falling, I was scared to death I was going to fall walking up here, but I made it, so we're good. Like Sherry said, my name is Shea Zigler, and I'm the coordinator at the Wayne County Family Resource Center. We're located at 714 North 12th Street, just around the corner from Mount Olive. It's actually in between Primex and the First Bank Boys and Girls Club. We're a little yellow house with a blue roof. It's really cozy in there. We offer tours anytime anyone wants to stop by and see the place. It's really cute inside, really warm and welcoming. We'd love to have you and show you around. So the Family Resource Center is part of Firefly Children and Family Alliance. And the goal of the Family Resource Center is to be a one-stop shop to connect families with the resources that are already in the area. So anybody in Wayne County that has children in the home under the age of 18 is welcome to come to the center, and we're able to connect them with resources in the area, whether that be housing needs, utility assistance, help finding childcare, applications for employment, kind of that one-stop shop. And we're not reinventing the wheel. We're just trying to get people connected with the great resources that are already in our community. Aside from the resource connection, we also have different events there. We have family fun events that are always free. There's always food, games, a lot of times prizes. You'll see on your table an example of those on our September calendar. There's also a quick blurb on the side that gives you a quick snapshot of what we do there at the Family Resource Center. We have a big focus right now on safe sleep and car seat safety. There's unfortunately a high infant mortality rate here in Wayne County, and we're trying to do our part to combat that. So we have safe sleep classes every Monday at 4 o'clock. Our liaison, Megan Gomez, teaches those. Parents are welcome to go to those. Babysitters, grandparents, anybody that's caring for an infant is welcome to attend those classes. It's a 30-minute class. At the end of it, you receive a free pack and play. For all attendees, receive a free pack and play. We also offer free car seat checks, and if we find that the car seat is expired or unsafe, we're able to get new car seats for folks as well. What else do we have? We also have what we call a Susie store. And so what it is, it's an open pantry for folks to come to. They can receive free hygiene items for babies, children, and adults. There's also take and make meals there. We have a safety store with baby gates, outlet covers, a lot of baby safety items. All of that's free of charge. It's very barrier free. You don't need a referral. We don't ask for income verification. You fill out a quick welcome form, and we're able to supply you with those. Yes.
When you said
Can grandparents come to get like covered for the, you know what I'm talking about?
Yes.
Walls,
Yes.
grandbabies?
Absolutely, yes. Anyone caring for children is welcome to utilize those services and the hygiene items and the safety items, absolutely. Yes. What else here? Oh, we also have, we try to work closely with other resources to bring events such as story time with Morrison Reeves Library we have at our center. We've recently partnered with DCS to have a kinship event, so a lot of grandparents taking care of their grandchildren, we were able to provide them free hygiene items. Let's see. Oh, we also have free Wi-Fi, free printing, free lamination at the center. A lot of times people come and they need a resume printed out or something like that. We're able to provide that at no cost as well. And if I didn't mention earlier, you don't need a referral to come to the center. Anyone's welcome to just walk in. We're open Monday through Thursday. Monday through Wednesday, we're open 12 to 5 p.m. Thursday, we're open from 12 to 5:30. And Friday, we offer by appointment only, but we can meet on Fridays as well. And I also put on the tables, you'll see a little QR code that says Firefly on it. And what that does is if you have a smartphone and you open your camera and take a picture of that QR code, it will take you to the Wayne County Resource Guide. And Firefly houses that resource guide, and so it will always take you to the freshest, most up-to-date resource guide on that. And that was just in August, all the updates were made. We call every single place on the resource guide and make sure everything's up to date. So that's up to date as of August.
Parent cafe.
Yes, we also offer parent cafes. You'll find a parent cafe every month of the year. And Reid helps sponsor that. And we house parent cafes as well as Birth to 5 and Girls Inc. And that's just a time for parents or anyone caring for a child to come, enjoy some support, some conversation, a free meal with others in their situation, talk about the joys, the challenges of parenthood, and just connect with other folks in the same, that are experiencing the same thing. So we have our next Parent Cafe actually tomorrow, and you'll see that on the September calendar as well. We also have Pam Zalea. She is our part-time bilingual navigator, so she's able to assist those folks who Spanish is their first language. Any questions? Yes, Betsy?
Is this just for Wayne County residents?
Yeah, so this is just for Wayne County residents. We were the 5th Family Resource Center in the state. We're now up to 9. The goal is to have a Family Resource Center in every county, so hopefully that happens sooner rather than later. But for right now, it's just for Wayne County. Sometimes we get Union County folks in there and we're able to assist them, but if we had somebody from another county, we'd be able to link them with another Firefly office, or I'm sure we'd be able to assist them. But Preble, yeah, that one we don't have. Yeah, unfortunately, no. I'm not sure what the Family Resource Centers look like over in Ohio, but we don't have one there. Yeah. Yeah,
I
Jean.
don't have a question, but if you get a chance, stop in and see the facility. They've done a wonderful job up there, and I've been able to work with them with some young ladies that I've helped out, and they just are full of information and just so kind to everyone. So I
Thank you.
recommend this facility.
Yeah, well, thank you. Yeah, and we're coming up on our 1-year anniversary next week, so we're having a birthday party over there where we're offering raffle prizes and food and games and cupcakes, so it should be a lot of fun. That's next week on the 18th. Yeah.
Now, I see you've got a couple of things like milkshakes and crafts.
Yeah.
Things that kids can come.
Mm-hmm. Yes.
Are the kids able to come at any of the things, even if they're for the parents?
Absolutely. Even parent cafes, we offer a craft and snacks during that time. So anything that's ever offered at the center, children are also welcome to come.
What are the ages kids usually?
I mean, we've had from babies all the way up to teens. So yeah. And then if a parent comes in and is needing help with, making some phone calls to area resources, we have what's called a kids corner where there's toys and crafts and that sort of thing where we can sit down and keep the kids preoccupied while the parents take care of business. Yeah.
And that there's computers.
Yes, there's computers. There's, like I said, free Wi-Fi, printing, lamination. We have a playground that's fenced in the back. Parents are welcome to utilize that as well. Anything else? Yeah.
I have a couple of things. It says safe sleep.
Mm-hmm.
And I was wondering, you said the car seat expiration?
Yes. So car seats have an expiration date on them. And so we want to make sure that when we're doing the car seat checks that we're checking that expiration date to make sure they're not expired. If they are, we'll make sure that we're not going to let anyone leave the center if they have an expired or unsafe car seat. So I have the ability that I could go to Walmart and get them a car seat.
On the car seats?
Yes, it is. I don't know exactly where on the car seat it is or if each of them are different.
Tag on the outside of it.
On the outside tag.
Buckle in, it should say the expiration date.
If you have any questions, please come by the center and we'll check it really quick, in and out.
Expiration of food, I didn't know car seats.
Yeah, I know. Yep. Anything else? We good? All right. Oh, yeah.
Now, it's surprising that you said Wayne County has a large number with child.
Yes.
What is it, like the SIDS or something else?
Yeah, so there's a lot of the infant mortalities we're seeing are due to unsafe sleep practices. So there are instances where parents have fallen asleep with their child and the child has, been rolled on, a sibling has maybe rolled on the child. There have been stuffed animals, blankets, pillows where there shouldn't be and the child unfortunately suffocated. There's just a lot of misinformation out there, and so we're trying to spread the correct information to keep these babies safe. So, yeah.
Your car seats, now how long is the expiration date or on them? I mean, how long is it supposed to last?
I'm not a certified car seat tech, so now I'm just, is it 5 years?
I think it's different for each seat.
Is it?
Yeah, like in the manual that comes with the car seat, tells you in that how long that specific seat is good for.
Okay.
You should check it when you first purchase it because sometimes depending, they may have had it a while and so your expiration date is very short.
Absolutely, and we really advise against going on Facebook or going to a garage sale to get a car seat just because they could be expired or they could have been in a vehicle collision and they don't disclose that and so they're unsafe, so just send them our way.
On the outside of the box as well as on the car seat itself?
Correct, yes. Yep. Yes. Yes, where am I looking? Yes.
Do you want to talk about the car seat that's coming up?
Yes, absolutely. Yeah, cool. So we have a group right now that we're calling Car Seat Connection, and Reid is part of that, as well as, thank you, the Wayne County Health Department, Richmond Police Department, their PAC team, and us at the Resource Center. And on September 21st, it's a Saturday, from 11 to 3, all of those partners are coming together at the municipal building in Richmond to do car seat checks. And there will be I think there's 3 or 4 certified car seat technicians there, as well as other helpers to keep kids corralled. But what we'll do then is we will check those expiration dates. We'll check to make sure they're installed correctly. If they are unsafe, or if someone calls and says, look, my kid I know is too big for this car seat, we'll have car seats there that they can take with them, and so their child will be safe as they go home. So this is free. All they'll need to do is call the Family Resource Center to reserve their spot. We have 3 lanes going, and we're trying to keep, everybody in a 30-minute slot and make sure that we have enough car seats for everyone. So if you know anyone, please spread the word. I think it's going to be a great event. Even if they know that they have a new car seat and they just want to check to make sure it's installed correctly, please encourage them to come. Yeah. Thanks, Andrew. Right. Well, thank you for having me. And like I said, you're welcome anytime. Thank you.
And once again, we want to thank you for coming. And October will be October 21st. And thanks again for joining us for Medical Monday. Thank you.